Okay, we'll go ahead and get started. Hi everyone, welcome to today's webinar. I'm Sharia Ali. I am the SLP advisor at ACSLPA. And today I'm going to be providing an update and a summary of the revised ACSLPA guideline on the assessment of linguistically diverse clients. We made this guideline, the final version, available sort of early to mid-December last year. That's a busy time for folks, so no worries if you've missed it. I'm just going to ask Mackenzie, who's ACSLPA's operations coordinator, who's also on the webinar, to just put a link to that guideline in the chat. So a few housekeeping notes before we get started. You'll notice your mic and your camera are automatically off. They'll stay off for the duration of the webinar. It's just easy for us to manage that sort of setup on our end. The chat is available to you to post your questions and comments as we proceed. I usually try to keep an eye on the chat as I'm presenting, and I like to respond to questions and comments as they come up, but we will have a time for questions at the end as well. So if you're having technical difficulties, please let us know in the chat. We can try to help you problem solve. If your technical difficulties are such that you don't have access to the chat, there are a few helplines in red on this slide. Give us a call or email and we'll try to help you problem solve as well. As we always do, we'll have a recording of this webinar available, I want to say in about a week's time, and you'll also get a PDF of the slides. Just have one other piece of information to add before we get started. It's personal, but it's relevant, I think, to this presentation, so gather around. Today, we're going to be discussing how to safely and effectively provide services to linguistically diverse clients. And I want to state up front that according to this guideline, I would be considered linguistically diverse myself. My first language, my preferred language, is not the dominant language of the place I live in. It's the Trinidadian dialect of English. And my home language, speaking it, using it, reading it, is very important to me. So I use the example of myself to underscore really what we're asked to do when we're assessing linguistically diverse clients. It's not a simple and easy thing. Many of you are probably here because you know that already. It's not simple, it's not easy. So while everyone who is linguistically diverse might not feel this way, we need to understand the value that our clients might have on their home and heritage language and how language can be strongly linked to identity and well-being and sense of self. So there's actually a potential for harm when we do this work. So that understanding was one of the foundations of the revised guideline. You might have noticed, hopefully you've noticed that we really tried to decenter standard English. We tried to move away from how do we assess clients who don't speak English, try to focus more on how do we as communication and hearing health professionals work effectively and safely within the context of linguistic diversity, which a lot of us do. So, quickly today, what we're going to look at is I will briefly go over why the guideline was updated and the major changes. I'll spend most of the time, as you can imagine, highlighting the practice guidance for SLPs and then for audiologists. And like I said, we'll have questions at the end. So another thing I was going to add right at the front, this webinar is not a teaching or instructional session on how to complete assessments for linguistically diverse clients. It's a high-level overview of the practice guidance in the guideline. So we won't be going into depth for each piece of practice guidance. The overall goal is that you're aware of what the guideline says and that you take that away and apply it to your practice. So first, why the update? As a regulatory body, ACSLPA, of course, tries to routinely update its practice guidance to make sure that what we're telling members is current. So last year, you also saw the informed consent guideline get updated and the hearing protocol, hearing screening protocol and guideline also get updated as well. So this guideline was previously called the Assessment of Children Who Are English Language Learners. It was actually developed in 2018, so it was due for a refresh. And while we have other practice documents from around the same time that are the same age, we made this guideline a priority for review because we know from member inquiries, general chatter on the ground, that this is a practice area where there may be some greater need. So we know members have a lot of questions. We also know that new knowledge is emerging all the time, and that has an impact on the competency that's expected of people who do this work. So next, some major changes, and I'll just use a table of contents to highlight where those are. First thing you probably noticed is that the title got a rehaul. We've replaced the term English language learners with the term linguistically diverse clients. So this change was made to better reflect and include the diversity of the Alberta public. So this might include clients who don't use English at all, they're not learning it, multilingual clients, clients who are learning a heritage language subsequent to English, etc. So you'll see a definition of linguistically diverse and some examples on page 2 of the guideline. But as we move through this presentation today, keep in the back of your mind, we've defined linguistically diverse clients as clients who do not use a dominant language of the place where they reside, so in Alberta English, and those who have multiple linguistic influences with varying degrees of proficiency across languages. Just a quick note to say here as well, the driving force for me really for the terminology change and for some of the changes in the practice guidance was initiated by a 2022 ACSLPA webinar by Dr. Andrew McLeod and Lucera Vargas Almeida, and that was entitled It's Not Just Translation. So I've linked that presentation on this slide. It's a really great presentation if you want to view that in tandem with the guideline. I think that's a really good idea. In general, throughout the guideline, we've updated the best practice, and we've also looked at how do we incorporate principles of inclusion and equity into the practice guidance. We've also tried to be mindful of setting constraints that regulated members may face. And so as best as possible, we try to be consistent with right touch regulation. We set absolutes only when it was necessary. So we only say members must do something only when necessary. The format of the document has also changed significantly because we've added significantly to the content. After the introduction, there's a section on general practice guidance, and this applies to SLPs and audiologists. And then we go into the practice guidance for each profession. So if you're reviewing this guideline, make sure you look at that general section and then the section specific to your profession. Another big change that's new to this guideline is we've provided guidance for adult and pediatric clients. In the previous version, it was only pediatric clients. Grown-ups are people too, they have assessment needs. And as always, we rehauled the appendices, glossary references, just to make sure things are as current as they can be. So in terms of that general guidance section, like I said, that's relevant to SLPs and audiologists. There are 5 pieces of practice guidance. The first is that practitioners should assess their own competence to complete assessments of clients who are linguistically diverse and take steps to maintain or enhance their competence as necessary. Remember, I said, and we all know best practice is continually evolving in this area. And we also know that some clients may have placed a very high value on their linguistic background. So, like I said, there's huge potential for harm if these assessments aren't completed competently and safely. For example, there's a potential for a client's or a community's language to be pathologized as a disorder, which is an example of cultural harm. Or a client could be denied much needed intervention if their communication difficulties aren't identified, which impacts their well-being and their quality of life going forward. So it's very important that you keep your skills current, be aware of the limits of your competence, and expand those limits as needed. The second point is that regulated members should be aware of linguistic bias and self-reflect on their own feelings towards linguistic diversity. We ask members to do this to identify, acknowledge, and address biases when working with clients who don't have the same linguistic background as them. So I know that might bristle some folks, but SLPs and audiologists do have linguistic biases. It's a real thing. It's demonstrated in the research that SLPs and other healthcare professionals can hold these types of biases. So we encourage self-reflection on this because we can't fix what we don't know exists or what we don't think exists. The third point builds on the existing ACSLPA standard of practice on communication. So of course, no matter the client, regulated members are expected to communicate effectively, respectfully, and clearly with all clients. Be mindful that there are extra considerations when working with clients whose first or best language isn't the same as yours. So ACSLPA regulated members are expected to take steps to minimize communication barriers based on client need, for example, knowing when more verbal discussion is needed as opposed to just providing a written report. And we're going to talk more in depth about interpreters later on in the presentation. Fourth point is a reminder again of an existing standard of practice on client assessment and intervention, and particularly the indicator to use sound professional judgment to ensure that you have a sound rationale for your clinical impressions. Now, you're doing this anyway for all clients, but we know this can be a little bit more complex for linguistically diverse clients. So we make the suggestion, provide examples for your rationale where appropriate, which also helps the client to understand what's happening as well. For example, if you're presenting a diagnosis of expressive language delay, you can provide some examples of skills that the client is demonstrating, along with some examples maybe of expected skills that were not observed. And the last piece of practice guidance, again in this general section for SLPs and audiologists, is that it's a regulated member's responsibility to provide a variety of recommendations to clients without making assumptions about client preference or skills. So, for example, if there are 3 viable treatment options, it would be important to share all 3 options without discounting any based on your impressions of the client or the family. We make a point here that a number of factors might influence a client's or family's decision regarding recommendations. For example, cultural norms about child rearing, views on disability, et cetera, et cetera, et cetera. So we say that regulated members should acknowledge and address client and family preferences, but not make any assumptions about them. So we'll turn now specifically to the practice guidance for SLPs. This is where I'm going to be, as you can imagine, spending most of the time. And then we'll get to the practice guidance for audiologists. So you'll notice in the guideline that there's about a 1-pager preamble on the importance of linguistically appropriate assessments for SLPs. So I'll leave it to you to review this section on your own, but I just wanted to highlight the content that was really the foundation for this document and for documents like it. We know, again, these assessments can be complex. Many are not straightforward, and this is really compounded by the lack of training that many of us dare I say, older SLPs experience, and the fact that there's an ongoing lack of resources that the research gap hasn't yet been able to fill. So this preamble acknowledges this, drives home the point that misidentification can have serious impacts on the clients, and underscores the need to follow best practice, including the practice guidance found in this guideline. So now we're going to dive into the practice guidelines now. And so the first one for SLPs is about comprehensive assessments. This one is a holdover from the previous guideline, and it states that all areas of speech and language must be assessed in order to reach an accurate differential diagnosis. Something new that we've added is to say that all language modalities used by the client should be assessed, including signed, gestural, or AAC modalities. So we're going to get to the second piece of practice guidance. This is probably why a lot of you are here. We're going to talk about standardized assessment tool use. So in the guideline, we say that these tools must be administered and reported on as intended. That's a standard line that you will see in any practice document like this. We provide a brief explanation about why these types of tools aren't appropriate for use with anyone outside of the normative sample. I think importantly, we've discussed cultural biases in these assessments and linguistic biases. So cultural bias is someone being questioned on content that's culturally unfamiliar to them, as well as linguistic bias, so that's someone being required to respond in a language that's not their first or strongest language. And we also say that because assessment tools are normed against milestones and norms of the regional community where they are created, we remind folks that using such a tool on someone outside of that sample reduces the validity and reliability of the results. So there's a line in there, again, a standard line we see everywhere. SLPs are expected to be knowledgeable about the standardized tools that they use and the normative samples of those tools. Another point that's raised, this is also a carryover from the last guideline as well, without much change, is that language dominance does not automatically equal monolingual proficiency. So therefore, the use of standardized tools that were normed on monolingual speakers remains inappropriate even for multilingual clients who use the language of the test as their dominant or preferred language. Guideline also notes that translation or interpretation of standardized tests is not recommended, given that there's huge variability between languages and that might confound administration scoring interpretation. And like I said, we try to be mindful of setting constraints with this guideline. So we're aware that situations do arise whereby funding agencies may recommend or even require the reporting of standardized scores, even for linguistically diverse clients. So we made some suggestions for how to report assessment information when standardized testing is not suitable for the client. For example, clearly outlining why such an assessment couldn't be completed, what scores can't be reported. So the full list of those recommendations are on page 6 of the guideline. Okay, practice guidance point 3 is one of the more lengthy ones in the document. It outlines that all of the languages that a client uses or is exposed to should be considered during assessment. And because multiple language acquisition is impacted by a number of factors, including age of acquisition, et cetera, and because we know proficiency might vary across languages, across settings, across time, we have listed for you something I'm very excited about, a number of linguistic background considerations, and you can find them on page 6 to 7 of the guideline. They're quite in depth. They cover adult and pediatric considerations. So I won't go into them now, but I think this list is really excellent. It's a great resource that you can use to help bolster your case history information. Practice guideline number 4 speaks to using as appropriate a variety of culturally and linguistically appropriate tools for the client. This guideline includes a non-exhaustive list of some of those tools, and that's on page 7, and that's just a screenshot of that list on this slide. So practice guidance 5 is also a carryover from the previous version of the guideline. There wasn't much change to content in this point. It's specific to pediatric clients, and it considers a difference in the development of conversational versus academic language skills, because we know that academic proficiency lags behind conversational in most cases, and we also know that the gap between the two might differ according to setting. So the practice guidance is that both types of proficiencies should be considered in assessment. So point 6 concerns dialectal and accent considerations. So it's important to note that historical geopolitical factors, namely colonization, would have resulted in populations and communities whose dialects of English are maximally different from the standard version. And dialect features might actually place clients at risk for unnecessarily pathologizing their language. Even if, and I think especially if they're reporting that they're monolingual in English. So I'll use myself as an example again. Trinidadian English has lots of special rules, you just have to know them. We don't use auxiliary verbs. Sometimes singular nouns have a plural s added. Sometimes plural nouns have the s dropped. You just have to know when and which words to use those on. And so I would only be able to report myself to be a monolingual English speaker. But if I was undergoing an assessment in English and I use some of those features, I would probably get a diagnosis of something, unless my SLP was aware that I spoke a dialect of English and worked to identify how that's impacting the results that they're getting in the assessment. So we give the guidance that regular members should be aware of the potential for this to happen, for dialectal features to be pathologized. And remember to inquire a bit more deeply about linguistic backgrounds of their clients. Use that list on page 6 to 7 of linguistic background considerations. Work with clients and others like cultural facilitators to gain an understanding of how dialectal features may impact assessment information. Now, I keep using the example of a Caribbean dialect of English, but in Alberta, we have to keep at the forefront of our considerations the variety of First Nations dialects that are used. and be aware that unnecessarily pathologizing dialectal features contributes to continued cultural harm and language loss and language eradication in these communities. So ACSLPA has, from a previous webinar, a brief outline of how First Nations dialects of English may differ from the standard version. And this was from a webinar by Dr. Patricia Hart-Blenden. I forget what year. It's linked on this slide, and it's also linked in the guideline. But no doubt, if these are communities that you work with, you'll need to delve into community knowledge and any available research a bit more for more information. So the second to last point for SLPs has to do with interpreters. And I'll just say that we also have a slide and practice guidance for interpreter use for audiologists. The guidance is pretty much the same, but when we get to the audiology section, I'll point out where it's a little bit different. So we say that because best practice indicates that assessment should evaluate proficiency in all languages used by the client, it's recommended that trained interpreters be used where appropriate and available. Interpreters are also can also be an important resource for the informed consent process and counseling after an assessment. And they may be able to provide information on language norms in a client's language. So as mentioned earlier, though, one thing you shouldn't be asking an interpreter to do is translate or interpret a standardized assessment for you. So we reference in the guideline, and it's linked in this slide, a really great article by Green is from 2022 on how we can incorporate interpreters as professional partners before, during, and after sessions with clients. The college also recognizes that not all members have ready access to interpreters, and in some cases you have to use someone who's untrained in interpretation to facilitate assessments. So while it's always preferable to then use an SLP colleague who speaks the same language as the client as an interpreter, based on some demographic information that we've collected from members, that might only be possible for a very small number of clients. So if you have to use a client's friend or family member for interpretation, we recommend caution, use your best judgment to select the most appropriate interpreter wherever possible. Factors to consider are age, linguistic ability, and the sensitivity of the information being shared. And of course, again, being mindful of setting limitations. We know that there may be times when no one is available for interpretation, trained or otherwise. So in those cases, we say regulated members will need to determine what assessment measures can still be taken accurately and effectively without an interpreter. It's also important to note that any reporting from such an assessment gives an indication of how the lack of interpreter might have impacted interpretation or analysis of any findings. And I'm just seeing a comment in the chat, but it seems kind of long, so I'm going to save that till the end so I have some time to read through it properly. So point 8 deals with home or heritage language use. The guidance here is that the provision of SLP services should support the use of the client's or family's home or heritage language as desired. So I think the as desired piece is pretty important. I've had situations in the past where parents stated to me that it wasn't a priority for their child to learn their home language. They wanted to focus on English. I've also had situations where it was vitally important to caregivers that the child learn their home language or their heritage language. So as communication professionals, it's not our job to make that decision for families or clients. We have to provide accurate information about multiple language acquisition so that informed autonomous choices can be made. And then when we sent the guideline out for member vetting, folks registered strong agreement with, and we're very happy to see included in the guideline, the information that's bolded in red on the slide. So I wanted to draw your attention to it now. It says regulated members should refrain from and counsel others to refrain from recommending that children with language disorders or delays be exposed to one language only. And supporting information for this can be found on page 8 of the guideline. So now we'll go into the practice guidance for audiologists. When we were looking at revising the guideline, We also took a look at the literature to see if there's anything that we wanted to include for in terms of practice guidance for audiologists. And what we found was that linguistic diversity can actually impact audiological assessment and management. So a client's language profile, example, the number of languages spoken, proficiency in the language spoken by the audiologist, may affect the ability to gather complete and accurate case history information. Also affects the ability of the client to accurately identify or produce speech sounds, and impacts communication with the client about the results and the recommendations. So as such, we wanted to provide some practice guidance as it pertains to audiology. So first piece of practice guidance for audiologists, because the client's language background may impact assessment. First piece of guidance is the recommendation that audiologists collect information on the client's language profile during case history. And we provide some examples. Some examples are shown on the slide, and they're in the guideline as well of what information to collect. And this information can help guide how assessment is implemented, as well as the interpretation of findings. So the practice guidance for audiologists, as I mentioned earlier, is pretty much the same for as for SLPs. The difference is our language is a little less strong for audiologists. We say that ideally interpreters should be used to facilitate audiological assessments, specifically with relaying instructions to clients and facilitating information sharing post-assessment. We also say, again, trained interpreters might be able to provide information or social or cultural norms that can help an assessment proceed safely and effectively for the client. And the guidance on when a trained interpreter is not available, when no interpreter is available, is the same as it is in the SLP section. So this guideline talks a bit about speech recognition and discrimination testing. And mainly that caution should be used when administering and interpreting these types of tests as part of the testing battery. As you can imagine, a client's linguistic background has an influence on how well they perceive speech sounds in the language of the test. So like with SLP assessments, that can make differentiating ability from the influence of being linguistically diverse kind of difficult. So that brings us back to why collecting information on the client's linguistic history and background is useful. That information can then be used to determine how and if speech recognition testing takes place. And of course, you should be mindful to document any confounding factors like the client's language background and how that limits interpretation in the client file. So as I mentioned earlier, the appendix, glossary, and references were all updated. And as we close, just like we did in the guideline, just want to send a big thank you to the members of the ACSLPA Idea Committee and the Ad Hoc Guideline Review Committee for their invaluable input on this guideline.